Hello dear viewers, I am Dr. Suyoga Vardhan DM, Assistant Professor, Department of Chemistry, Sri Venkataramana Swami College, Bantwal. So today I am here to discuss about an important topic in biochemistry, that is chemotherapy. Why I said an important topic is because it is very necessary to understand about chemotherapy. What is meant by chemotherapy? Chemotherapy means, as the word itself says, chemo means chemical and therapy means treatment. Nowadays, whole world have been dependent on this chemotherapy or chemical treatment. Mainly we can distinguish the treatment into two types. One is Ayurvedic treatment and another one is this chemical treatment, or in simple words it is also called as Western medicine or English medicines. So nowadays we are widely using chemical treatment methods in various diseases to get cured. For example, recent days, so the whole world is searching for hydroxychloroquine, which is an antimalarial drug. So it is a chemical drug or a chemical compound which has been used to come across malaria. So let me discuss what exactly chemotherapy means and who was the first person to coin this term and how do we define it and what are the different classifications we can make under these chemotherapeutic drugs and what are its uses, benefits, how we are going to synthesize it and what are the applications. So all these will be discussed in detail in this class. As I said, chemotherapy means chemical therapy or chemical treatment. So the word first used by Paul Ehrlich, and for this reason he has been called as the father of chemotherapy. According to him, he defined chemotherapy as the use of drugs to injure an invading organism without causing injury to the host. That means the chemical drug or a chemical compound which has been used to kill the invading organisms. Say for example the microorganisms which tend to cause diseases to human body. So that has to be killed, then only we will get cured. So these chemical drugs, what they will do, they are going to kill the invading microorganisms without causing injury to the host. That means it should not cause any side effects in our body. It should not kill the cells which are present in our body. So such chemical drugs are called as chemotherapeutic agents and the term or the process is called as chemotherapy. So according to Paul Ehrlich, a chemotherapeutic agents are the chemical substances which have selective toxicity towards invading organisms and low or no toxicity towards the host. The chemotherapeutic agents are the drugs used in the treatment of various infectious diseases are classified as follows: antibiotics, analgesics, sulfonamides, antiseptics and disinfectants, antimalarials, antiprotozoal agents, antiviral drugs, antineoplastic agents, etc. Like this way, we are going to classify the chemotherapeutic agents into different ways as they are used for the treatment of various infectious diseases. Now, let us understand one by one. The first one, antibiotics. We all have heard about this word, antibiotic. So, these are the chemical drugs which have been used by the doctors when they want to cure or when they want to kill the microorganisms which are causing disease permanently or very in fast manner. So, antibiotics acts as very fast response towards the kill of invading microorganisms. So, what is meant by antibiotic? An antibiotic is defined as a chemical substance or compound produced by various species of microorganisms or living organisms such as bacteria and fungi, which in low concentration destroy, kill or inhibit the growth of other species of microorganisms. Antibiotics, they are also of various species of microorganisms or they are living organisms. So, they are used to kill other species of microorganisms which are going to cause diseases in the human body. In Greek words, anti means against, bio means life. The first antibiotic was discovered in 1896. And next, Alexander Fleming in the year 1928, he rediscovered it from the filamentous fungus, what is called as Penicillium notatum. So, the first antibiotic which has been invented was penicillin. We all have heard about it, penicillin injection. We are going to take it to avoid the infections which are going to caused by different microorganisms. And also chloramphenicol is another example of antibiotic. What are the conditions to be satisfied by an antibiotic to be used as a therapeutic agents? So, the first one is an antibiotic must be effective against a pathogen at low concentrations. So, that is very important. So, the antibiotic should not be used in higher concentrations. If you use a higher concentration of drug molecule, it will be very difficult to get it out of our body once its action has been carried out inside our body. So, what is the action of these antibiotics? So, they are going to kill the microorganisms which are going to cause diseases in our body. So, once this antibiotic has been activated and if it goes to the parasite and kills it, it has to be removed in our body. So, it is easier to remove the antibiotic once after its work has been carried out only when its concentration is low. So, that is why the concentration should be lower. And the second point is it must not cause significant side effects. So, that is very important. All English medicines, Western drugs, what we call as, will have some side effects, definitely, that is for sure. All the medicines will have some side effects. Because of this reason only, the medicinal research field is emerging day by day. Scientists are eager to find out new drugs for the diseases which have already been there, because the drug what they are going to synthesize or prepare, that should be a minimal side effects possessing drugs. So, that makes the medicinal chemistry research to grow. So, that is the second point, that is it should not cause significant side effects. and its stability must be high. That is the third thing. And it can be stored for long time period without appreciable loss of its activity. So these are some of the conditions that has to be satisfied by an antibiotic to be used as a therapeutic agent. So next is, let us see how the chloramphenicol has been synthesized and what it is and how does it works and what are its uses in the treatment of various diseases. Chloramphenicol is an antibiotic produced by Streptomycin venezuelae, an organism first isolated in 1947 from soil. Now let us see how we are going to synthesize it. Para-nitroacetophenone, so this is what is called as para-nitroacetophenone. This on bromination gives the corresponding bromo derivative. So this is the bromo derivative, which on treatment with hexamine followed by acidic ethanol gives a alpha amino para nitroacetophenone hydrochloride. This on acetylation gives the acetamido derivative, which on treatment with formaldehyde followed by aqueous sodium carbonate affords the corresponding hydroxyl ethyl analog. Then the keto moiety is reduced with aluminum isopropoxide to obtain the DL form of the product, which on treatment with HCl forms the chloramphenicol base in DL form. The resultant product is subjected to resolution with D-camphoric acid and then treated with dichloromethyl acetate to yield chloramphenicol. So this is our final compound, what is called as chloramphenicol. In this way, we are going to synthesize chloramphenicol. What are the uses of chloramphenicol? It has been used for the treatment of number of bacterial infections. The first one is, it includes use as an eye ointment to treat conjunctivitis. Conjunctivitis means it is the inflammation or infection of the outer membrane of the eyeball and the inner eyelid. Okay, so the infection, what we can see in our eye, the white part, so it will get infected. Okay, so due to the act of bacterial infections. So for that, so we are going to use a ointment which consists of chloramphenicol. It is also used in the treatment of ear and certain skin infections. Next is, so it is also used to treat the meningitis, that means inflammation of brain and spinal cord. So this is typically caused by an infection. Meningitis, it is typically caused by an infection. So chloramphenicol has been used as a drug to treat meningitis, plague, cholera and typhoid fever. So these are some of the uses of chloramphenicol. Next class of chemotherapeutic agent is analgesics. The meaning of the word analgesics is pain relievers. Any drug or a chemical compound which reduces the pain, or an analgesic or painkiller is any member of the group of drugs used to achieve relief from pain. So these analgesics can be further classified into two types. One is narcotic analgesics and another one is non-narcotic analgesics. So now let us understand one by one. What is meant by narcotic analgesics, or it is also called as opioids? So narcotic analgesics are drugs that relieve pain by binding to opioid receptors which are present in the central and peripheral nervous system, can cause numbness and induce a state of unconsciousness. So these class of drugs are called as narcotic drugs. These drugs may not alter the sensation of pain but modify the emotional reaction to pain. The pain may be present but may not be perceived as painful. That means, so these drugs will alter the emotional reaction to the pain, that it is going to create a numbness and it will allow us to sleep and will not feel the pain. Such type of drugs are classified as narcotic analgesics. Examples of these drugs are, the first one is morphine. What are its uses? So it alters psychological response to pain, specifically used in treating post-operative pain, acute and chronic pain. Post-operative pain, that you might have understood about what it is. So once after the operation has been done, the doctors will stitch the portion or the position where they have operated, so that will create a pain. So it takes some time for that to get cured. But at this stage, if you take a drug that is narcotic analgesic drug, for example morphine, so it will allow us not to feel that pain. That pain will be there, but that is not felt by us. So such type of drugs are called as narcotic drugs. And another example of this is methadone hydrochloride. So this methadone hydrochloride, it is also used as chronic pain and it exerts sedation and antitussive, that is suppress of relief coughing properties, temporary maintenance and treatment of drug addicts. And another example is pethidine hydrochloride. So this is used in the relief of a variety of a moderate to severe pain, including the pain of labor and post-operative pain. And the next one is pentazocine. So this is used to control moderate to acute pain. Acute pain means what? Acute pain is a type of pain that typically lasts less than 3 to 6 months. So such type of pain is called as acute pain. That means it is not cured in a very fast manner. Means the pain which is persisting, so that will last for 3 to 6 months. It is a long process. So during this time, to avoid the feel of that pain, we should take some drugs. So that will give us a numbness, or that will create an emotional reaction to the pain. As it says, the pain may be present but may not be perceived as painful. So these are some of the examples of analgesics, especially narcotic analgesics and their uses. And how we are going to synthesize this? So morphine is derived from natural sources and then purified. From this, various analogues are prepared. We are going to further derive this naturally obtained morphine and we are going to classify them or convert them into various different analogues. And next one is pentazocine. So pentazocine is obtained by condensation of 1, 2, 3, 4, 5, 6 hexahydro 6, 11 dimethyl 2,6-methano 3-benzosin 8-ol, which is an alcoholic compound. It is a long compound. It has been nomenclature through IUPAC name, so that is why it looks or it seems a little big compound, with 1-bromo 3-methyl 2-butene in the presence of dimethyl formamide medium. So dimethyl formamide acts as a solvent in the presence of sodium bicarbonate under refluxing condition. So this is how pentazocine is synthesized. So now let us see what are the side effects of this narcotic drugs. Obviously side effects will be there. So what are those? The narcotic analgesics produce euphoria. So that is an emotional and mental state defined as a sense of great happiness and well-being. So it is going to produce euphoria. And next, respiratory depression. We might feel difficulty in respiration and decreased gastrointestinal motility. Okay. And next is increased biliary tract pressure, that is increased secretion of bile juice, etc. So these are some of the limitations of narcotic analgesics. And now let us move on to non-narcotic analgesics. So non-narcotic or non-opioid analgesics encompass the non-steroidal anti-inflammatory drugs, what we call as NASADs. So certain antipyretic agents used to reduce fever also show mild analgesic properties. So what are the examples? Indomethacin. So indomethacin is an example of non-narcotic drug. So it has been used as an antipyretic, analgesic and anti-inflammatory effects, and it is used in the treatment of arthritis and spondylitis, etc. And next is ibuprofen. Ibuprofen is very familiar. So it is the number one drug which has been used as an anti-inflammatory agent in US till today. So what are the uses of ibuprofen? So it is used to arrest flares and long-term management of rheumatoid and osteoarthritis. So what is meant by rheumatoid? So it means chronic inflammatory disease, and osteoarthritis means so degenerative joint disease. And next is acetaminophenol or paracetamol. So paracetamol is very famous in India also. We all have heard about it. Paracetamol, Dolo 650, paracetamol. So that is a commonly taken medicine to come over fever. So what are the uses of this? Treating arthritic and rheumatic conditions and musculoskeletal pain, and it has been used as aspirin for sensitive patients. And next example is ziconotide. So this is used in the treatment of severe chronic pain in people who cannot use or do not respond to standard pain relieving medications. So these are some of the examples of non-narcotic analgesics and their uses. Now let us see how we are going to synthesize these compounds. Let us take two examples. One is ibuprofen and another one is paracetamol. So ibuprofen is synthesized by heating para-isobutyl acetophenone with hydrogen iodide in the presence of red phosphorus followed by hydrolysis. So this is how we are going to prepare or synthesize ibuprofen. And next is paracetamol. Paracetamol is prepared by the reduction of para-nitrophenol followed by acetylation with acetic anhydride and glacial acetic acid mixture. The crude product what is obtained is purified by recrystallization from appropriate solvents. Next is about sulfonamides. Sulfonamides are the first successfully synthesized antimicrobial drugs. The mechanism of sulfonamides antimicrobial action involves competitive inhibition of folic acid synthesis, which prevents the growth and reproduction of microorganisms. So, what these sulfonamides are going to do when they are taken through orally inside our body? So, once sulfonamide drug gets into our body, so it is going to secrete folic acid through synthesis. So, this increase in the folic acid leads to the competitive inhibition of growth and reproduction of the microorganisms, which causes various diseases. For example, sulfadiazine, sulfathiazole, sulfamethoxazole, etc. These are some of the examples of sulfonamides. Para-aminobenzene sulfonamide or sulfanilamide was first synthesized by Gelmo in the year 1908. Now, let us see how we are going to prepare sulfanilamide. Benzene on nitration yields nitrobenzene, which on reduction with tin and HCl gives aniline. Aniline upon treatment with hot concentrated sulfuric acid forms para-aminobenzene sulfonic acid, which on chlorination with phosphorus pentachloride gives para-aminobenzene sulfonyl chloride. This on amination with concentrated ammonia yields sulfanilamide. So, in this way we are going to prepare sulfanilamide. And sulfacetamide is also prepared by the selective and partial hydrolysis of NN diacetyl derivative of sulfanilamide, which is obtained by the acetylation of sulfanilamide structure. And these are the two general methods for the synthesis of sulfonamides and for the synthesis of sulfadiazines. So, here if we observe, so benzene on nitration, it is going to form nitrobenzene, and further nitrobenzene on reduction, it is converted into aniline, and it is treated with acetanilide and it is converted into acetanilide, and next further it has been derived into various intermediate products to form sulfonamides. In the same way, we are going to synthesize sulfadiazines. What are the uses of sulfonamides? Sulfathiazole is useful against staphylococcal infections and in bubonic plague. Sulfacetamide is used in the prevention and cure of urinary tract infections. Sulfaperidine is effective against pneumonia. Sulfanilamide is rarely being used due to its toxicity, but still used in veterinary medicines. So, like this way there are number of uses of sulfonamides. And next class of chemotherapeutic agents is antiseptics. Antiseptics are the drug substances which inhibit the growth of microorganisms, usually on a localized area of the body. Antiseptic may also be defined as a chemical substance which inhibits the growth or kills the invading microorganisms on living surfaces such as skin and mucous membrane, It prevents sepsis, that is blood poisoning, and antiseptics are applied before every invasive procedure, be it a simple hypodermic injection or a major surgery. For examples, hydrogen peroxide, alcohol, boric acid, hexachlorophene, povidone, that is polyvinyl pyrrolidone, and it has been also used in dyes such as brilliant green, crystal violet, etc. So now let us see what are the differences between antiseptics and disinfectants. So here I have made table which will be very clear for you. So bacteriostatics and do not necessarily sterilize the surface under treatment. So antiseptics are bacteriostatics, whereas disinfectants are bactericides which are applied on non-living or inanimate surfaces to sterilize the surface to which it is applied. And antiseptics prevents the growth of microorganisms as long as it remains in contact with them, whereas disinfectants rapidly kills the target organisms and it produces irreversible lethal effects. Antiseptics action is milder and more prolonged, whereas disinfectants shows immediate action which is of short duration. Antiseptics destroy the infective agents without harming the host tissues, but many of them have limited activity and may show adverse effect on the tissues, whereas disinfectants play a major role in public health and water treatment. The next is hypoglycemic agents. Hypoglycemic agents are the drugs used in the treatment of diabetes mellitus by lowering the glucose level in the blood. Diabetic condition is produced when the beta cells of pancreas secrete insufficient insulin required for the glucose metabolism. So this is what is called as type 1 diabetes mellitus. That means insufficient secretion of insulin leads to the glucose metabolism will be reduced and it causes type 1 diabetes mellitus. Or due to obesity also a diabetic mellitus will be caused. So this is because of abnormal insulin levels which is classified as type 2 diabetes mellitus. Usually type 1 diabetes is treated with insulin or insulin variants, but type 2 diabetes is treated with non-insulin anti-diabetic agents. There are different classes of anti-diabetic drugs and their secretion depends on the nature of the diabetes, age and situation of the person as well as other factors. That means not one drug will be given to all the diabetic patients. So the drug which we are going to take will be different depending upon the age and situation of the person and also with the amount of glucose that has been present in his body. With the exceptions of insulin, so axinatide and other drugs are used as anti-diabetic drugs. For examples, tolbutamide, glipizide and troglyterazone etc. are classified as hypoglycemic agents. Now let us see what are the compounds of aluminum used as pharmaceutics. Aluminium sulfate is medication used to prevent infections and to treat minor bleeding. It is also used in deodorant preparations. Aluminum acetate solution is used as germicide, that means which kills germs, and also it has antiseptic property. Aluminium sesquichlorohydrate is an antiperspirant used to reduce sweating. Aluminium containing compounds are also used as astringent and deodorant. Next is compounds of phosphorus as pharmaceutics. Phosphorus is essential to every living cell. The organic phosphatic compound deoxyribonucleic acid, what we call as DNA, provides the genetic code for life, and adenosine triphosphate ATP is essential for cellular energy conversion. Phosphorus compounds in general or phosphonates in particular are a cornerstone in pharmaceutical drugs. Many of these compounds exhibit antifungal, antibacterial, anticancer and significant analgesic or anti-inflammatory properties. For example, bisphosphonates, aminophosphonates are the examples of the compounds which contain phosphorus as pharmaceutics. And next class of chemotherapeutic agents is disinfectants. Disinfectants are antimicrobial agents that are applied to the surface of non-living objects to destroy microorganisms that are living on the objects. In general, disinfectants are the chemical or physical agents which specifically kill the vegetative forms of microorganisms. For example, alcohols, quaternary ammonium salts, glutaraldehyde, bleach, chloramines, chlorine dioxide, thymol, potassium permanganate, iodine, etc. So, these are some of the examples of disinfectants. Disinfectants kill more germs than sanitizers. Disinfectants are frequently used in hospitals, dental surgeries, kitchens and bathrooms to kill infectious organisms. Bacterial endospores are most resistant to disinfectants. Now, let us see what are the uses of antiseptics and disinfectants. The first use is as hand washing. Chlorhexidine gluconate and povidone iodine solutions are often used in hand scrubs and hand rubs in hospital settings. Next, the second one, that is disinfection at homes and hospitals. Lysol, prepared from cresol, is an active disinfectant. Dilute hypochlorite solution can be prepared, and when required for personal use, and it will be used as a disinfectant of feeding bottles, that is for infants. And next is benzalkonium chloride is used as an antiseptic detergent, and 0.05 percentage solution of it is used to store surgical instruments. And glutaraldehyde is also used as sterilizing solution for equipments at surgical instruments. And next use is as a pre-operative skin disinfection. Antiseptics applied to the operation site to reduce the resident skin flora. So, here care has to be taken while using it, because If it is used in facial use of solutions containing chlorhexidine like chlorhexidine gluconate, as this can injure the eye causing keratitis. Also, a tincture having 1.44 percentage of chloroxylenol is used in preoperative skin disinfection. And next is cetrimide. It is also used as preoperative skin disinfection to clean the skin. Next is mucous membrane disinfection. Antiseptic irrigations may be instilled into the bladder, urethra or vagina to treat infections or cleanse the cavity prior to catheterization. And thiomersal is very dilute in solutions, that is 0.01 to 0.2 percentage is used for such purpose. Various compounds of urotropine are used as urinary antiseptics. And next use is preventing sepsis, that is blood poisoning, and treating infected wounds and burns. Antiseptic preparations are available over the counter from your pharmacist to treat minor cuts, abrasions and burns. Chloroxylenol 5% is used for wound disinfection, which is an active ingredient of Dettol. Cetrimide is used in the form of creams and ointments for the treatment of wounds, burns and certain skin diseases. And the last use of antiseptics and disinfectants, that is treating mouth and throat infections. Deculinium chloride has both antibacterial and antifungal properties and is the active ingredient in antiseptic throat lozenges. Thymol, amyl metacresol are also used in mouth washes, gargles, etc. So, like this, the antiseptics and disinfectants are widely used in various aspects of our day-to-day life. At this condition, so it is very important for us to understand about antiseptics and disinfectants, I think. So, with this I am going to conclude that the chemotherapeutic agents are very useful for the well-being of